Only me and Kaushik are available.
Suresh, get the water. Good evening to everyone and welcome to today's wonderful evening. Every exam is a pattern. Every examiner wants certain basic things. The moment you touch base those basic things, you are on the top of the world of preparation. Any amount of high yield facts theory we study, ultimate satisfaction doesn't come unless we finish what had been in the past 10 years of NEET PG exam. So with that intention, with another 10 days, maybe 9 days left over, including today 10 days, let's quickly run through 10,400 questions. This is super rapid, crazily, maniacally fast because there is nothing to explain, only to touch base. Some places where we need to explain, we will go a little slow. So thanks to Diksha, Mithuna, Dinisha, and Anam, Sultana, Shadan, and Kaushik, and also 23 online classmates, Amrit and everybody, for joining this event. Tomorrow we'll start early, at least 7 to 8 hours. Let us plan to hit about 1,000 questions, provided you prompt me in the morning to come to class. Yeah, you called in the morning. I agree. Nice to see Sobia, Roshan, Gauri, Nazir, Jaman, and many more. Let's make the great beginning, doctor. A pregnant woman had meconium stained LICA, underwent emergency cesarean, ultrasound show edematous bowels. It is paralytic ileus. So paralytic ileus typically she underwent surgery, right? So post-operative, agree. Magnan's phenomena is an addiction of cocaine. Very good. Itlundale. Alcohol dependent syndrome, what is accept?
No tolerance.
No tolerance. Very good. Withdrawal cage questionnaire, you need to remember about? With regard to the alcohol dependent syndrome, I think this is a repeat. In rural area, cattle shed should be how many away? Good guess. Don't try this kind of questions in tomorrow's NEET PG. Tomorrow he will ask pig shed should be how long away? Then fast induction and recovery. Come on. Fast induction and recovery. Oh, nitrous oxide. Fastest induction and recovery, making it the best choice for anesthesia. One minute.
Somewhere it is global warming.
Now, maximum global warming is caused by? Suresh, kuch manchil kaavali. Yes, doctor. Maximum global warming is caused by desflurane. You guess desflurane?
Mnemonic is Disney, sir.
D for?
Desflurane, isoflurane, sevoflurane.
Disney. Wow, that's good. Post-operative shivering is treated by? We discussed this.
Yes.
Fast. Pethidine. Which anesthetic has maximum MAC? Fast है ना, इतना slow है तो मजा नहीं है. Nitrous oxide. Which anesthetic contributes to greenhouse effect? Desflurane. See, दो बार पूछा है greenhouse desflurane. You must be waiting for desflurane and greenhouse in the tomorrow's NEET PG. Which agent sensitizes myocardium? Halothane. H for heart. Patient giving inhalation agent develop fulminant hepatitis. Sir? Huh? Halothane. Very good. All are contraindications for spinal anesthesia except?
Hypertension.
Very good. మంచి గెస్ కొట్టినావు మిథున. ఇప్పుడు చదివినరా? आप ज्ञानी हैं, हम मान लेंगे. और 2-3 ऐसे शॉट्स देना, हमारा कॉन्फिडेंस बढ़ेगा कि yesterday I got an aphthous ulcer. I sent to my friend, अरे क्या है रे, ये कार्सिनोमा टंग है क्या? I want carcinoma anywhere, not in the tongue. So, chup re, your students are having NEET PG, you are getting aphthous ulcers bole. Huh? So, good. Good to see Shweta Kawa. Suresh, na question is chala fast ki bala. 14 అయిపోయినాయి అప్పుడే. Okay. These are all false about 10 to work. Come on, fast. Least potent wrong hai. Good. It is most potent and is not a good muscle relaxant, is heavier than air and diffusion hypoxia can occur. Huh? About nitrous oxide, what is accept? It's not a good muscle relaxant. It's a laughing gas, megaloblastic anemia, diffusion hypoxia. These are all advantages of a laryngeal mask. Except. Huh? It doesn't prevent aspiration. It is more reliable than face mask alternative to endotracheal intubation, does not require laryngoscope to visualize. It is an alternative. The drugs that increase the risk of post-operative nausea, vomiting after squint surgery in children, except.
Propofol.
Very good.
It's not used for the surgery at all.
Very good. Excellent. Excellent, doctor. So propofol is the short-acting IV anesthetic, lower incidence of PONV after squint surgery. Not bad, eh? Good guess. At the end of anesthesia, after discontinuing nitrous oxide and removing endotracheal tube, 100% oxygen is administered. Why do you do that? To prevent what?
Second gas effect.
Diffusion hypoxia. It is due to the inadequate oxygen delivery to the tissues. And already you know, second gas effect is an effect of nitrogen in the alveoli following the discontinuation of the nitrous oxide anesthesia. Best uterine relaxation? Halothane. ये बार बार भूल जाते हैं, वो कुछ अजीब बात नहीं है. Yeah. So good to see 39 online classmates for 10,000 MCQ revision of the last 10 years of NEET PG का पूरा rip off करके exam को जाएंगे. That is the best way to beat the tension in the last moment before exam. मेरा preference है रात 12 बजे के बाद भी बैठ के पढ़ेंगे बोले तो पढ़ेंगे. हमको भी नींद आएगा, आपको भी नींद नहीं आ रही. Good, good. Shweta and everybody, keep punching your answers, including the question number. That makes it easy. So now you are listening to 10,000 MCQs in 10 years. NEET PG ka pura ऐतिहासिक discussion. Drug of choice for buyer's block? Very good. Abba. Very good. अम्मा विनीशा నువ్వు కూడా ఆన్సర్ చేసినావు అంటే భారత్ ఆన్సర్ కరేగా. డ్రగ్ యూజ్డ్ ఏమైంది? Bupivacaine versus lidocaine. Bupivacaine ఇవ్వద్దు కదా. It is cardiotoxic, no?
Yes.
Bupivacaine is cardiotoxic. Bupivacaine should not be given, no? Just check that. Check that. What is the drug used for emergency intubation? Very good. Propofol. Etomidate is not used for long-term infusion. Why? Hey, come on. We discussed this. There are two drugs that lead to adrenal suppression. Come on. Adrenal suppression is caused by etomidate. Etomidate. So that is the reason. Very nice. 41 online classmates. Inform your friends. 10,000 questions in next 10 days. Let's hope God gives the energy. Bupivacaine. है ना? हाँ मारे मेरे नल्ला मतलब बेदरिस्तर lidocaine. In NEET PG preparation and living a marriage, there is nothing called best moment. It is the present moment that matters. Gas partition coefficient is a measure of speed of induction and I told you, relation between Mach, potency and glass partition, blood gas, B by G, BG coefficient. Cheppinna leda nenu? Pardon cheppinna leda? Are malla. Very good to see 45 online classmates. बहुत मजा आ रहा है. My goal is one day in this next 10 days, 1,000 students should sit. Bharat, Appa, Bharat. ద్రోణాచార్యుడికి అర్జునుడు వచ్చిందంటే అదొక ఆనందం ఉంటుంది. అట్లనే అరైవల్ ఆఫ్ కౌశిక్, భరత్ అండ్ ఎవ్రీబడి ఈజ్ ప్లెజర్. గుడ్ గుడ్ గుడ్. हमको भी घर में टेंशन आ रहे. I was today metro train is very crowded. I'm just packed in the middle. So suddenly one of my patient, he, sir, you आप मेट्रो में बोलता. हाँ भाई, he had triple vessel disease with MI. I said, you got into metro with triple vessel disease. Why can't I get in metro? Sir, आपका BMW क्या हो गया? सर बोला, नहीं BMW नहीं, वहाँ मर्सिडीज बेंज से भी अनमोल स्टूडेंट्स वेट कर रहे हैं. अगर मैं ये ट्रैफिक में कार में बैठे तो 2 घंटे लगेगा. So that's the reason I got into. So until I came to Nampally station, he's not able to accept the reality that I'm on his side traveling in metro. He was telling, "Ab butto, doctor sahab baithte bolte. Where will people will care? You are a great man only in your place, not everywhere, right?" Good. It was a good experience. Come on, in Bayer's blog. Sorry. No, intravenous. No, except together. Okay. Intravenous should be the answer. Okay. That was a wrong answer. Yeah. What is the inducing agent of choice in shock? Inducing agent of in shock is ketamine because it rises everything. Very good. Intraocular pressure is increased by ketamine. Local anesthetic with prolonged action is longest action, so it is not used. Very good. Dibucaine. There is something called Dibucaine number. Dibucaine number. Huh? Dibucaine is the local. I mean, your pancuronium, they all have very long action. Pipecuronium, pancuronium, very long, doctor. If they are given, definitely. Dibucaine is the one which is not used but longest. Not induced in included neuraxial block. Bayer is not. Percentage of adrenaline with lignocaine for local infiltration. मैंने बोला कि never make guess on this kind of questions, okay? Local infiltration का मैंने दिया भी ना, स्टैट्स दिया. एक बार देखो, रिकन्फर्म करो. Oxygen to nitrous oxide in Entonox. Very good. Short-acting non-depolarizing blocks. Very good. Mivacurium is the one which is metabolized by esterase. Good. I'm proud. Shortest acting local anesthetic among them? Huh? Which has a duration of only 15 to 30 minutes. Lignocaine has 1 to 2 hours. Bupivacaine has 2 to 4 hours. Chloroprocaine 15 to 30 minutes. Supreme LMA characteristic is laryngeal mask airway. Okay, I'm not very sure what is this. True about conscious sedation is conscious sedation, dissociated anesthesia. Except?
All protected.
Very good. You said C? Good. CNS depression, patient is conscious, patient can obey commands. There is CNS depression in that. What is the mark of desflurane? It can be cruel. 6. The point is, never make guess. This kind of question, भगवान की प्रार्थना करके, and don't suffer FOMO. अरे कोई आंसर करे, कोई भी नहीं. जो आंसर करेगा वो पाताल लोग चलेगा. Right? So वो पाताल भैरवी क्वेश्चन है. Which anesthetic neither metabolized by liver nor kidney? Hoffman's degradation. Beautiful. Not bad, no? दो कौड़ी तो सीख लिया. दो कौड़ी नहीं क्या बोलते? अच्छा दो कौड़ी कमा लिया बोलते ना. अच्छा एक दो सीख लिया बोले तो क्या बोलते बेटे हिंदी में? రెండు మూడు ముక్కలు నేర్చుకున్నాం అంటే. Which can be given by epidural anesthesia? Remifentanil. You can give fentanyl, alfentanil, morphine. Arey, what are all the things that are given in epidural anesthesia? बोल के मैंने एक paragraph दे दिया. Which drug is the choice for reversal of muscle relaxant after anesthesia? Oh, very good. Which is associated with maximum histamine release? Beautiful. D-tuberculine, not bad. Very good. Which is a cardiodepressive? Which is not cardiodepressive? Etomidate. It is adrenal depressive, not cardiodepressive. 1 to 2 mm hemorrhages of skin are known as petechiae. ऐसे चिल्लर क्वेश्चंस भी आते हैं. Third part of duodenum is not related to. जरा लिख लो. Duodenum relation एक बार मर्तबा पढ़ना पड़ता. Superior mesenteric vessels, right ureter, head of pancreas. This is purely what ना. अगर आप prepare हुए तो आप try करोगे, नहीं तो don't try to measure yourself. अच्छा liver यहाँ है, उस पे quadrate lobe यहाँ है, वो वहाँ है, बोल के try करे तो गया. Third and fourth lumbrical or foot are supplied by pinch करके try करो. You know it. Lateral plantar no. They are on lateral side. Which is the branch of tibial nerve? Medial plantar nerve supplies first and second lumbricals. Peroneal supplies anterior compartment. Third extensor compartment of the wrist contains tendon of. Very good. 44th question, 44 students. Very good, doctor. Please inform your friends also. अच्छा टच करके EPL tendon. How did you?
I said, sir, it's started the book.
अच्छा एग्जाम हॉल में टेस्ट करके बोला अपने हाथ के ऊपर टेस्ट कर. Third extensor compartment of the wrist contains. చూసారా ఎన్నిసార్లు అడిగారు నీట్ పీజీలో? It is located on the radial side of the third extensor. మళ్ళా మీ సెకండ్ ఎక్స్టెన్సర్ ఏం వచ్చిందో అల్నార్ సైడ్ ఏమున్నదో జర అని చూడండి. ఓకే 45-year-old underwent radical mastectomy with axillary clearance. She could not lift the arm above the head. Long thoracic nerve of Bell. Very good. All pass through deep inguinal ring except very good. Ammo. Vinishaka kotettadi. MD pediatrics kotettadi. Vinishaka. Huh? Child age at 7 years has how many teeth, Vinisha?
20.
ఎందుకు అంత కాన్ఫిడెంట్ తప్పు చెప్పుడులా కూడా అంత गुंडागिरी के साथ बोल रहे हैं आप? Totally 28 teeth, but the permanent teeth, which are also a total of most children have all their primary teeth by age 3.
Till 8 years there will be 20, sir.
Oh, చూడమ్మా ఒకసారి ఆన్సర్ చూడు మళ్ళీ చూడు ఒకసారి రీకన్ఫర్మ్ చలో. Who is right, who is wrong? 26 and 20, yeah?
According to our knowledge.
Huh?
20 are the normal guess. 20 sir, 20 primary teeth.
20 primary teeth amma. Total teeth any?
Primary teeth are replaced by permanent teeth, which usually start to appear around age 6 to 7 years to 26 ఉండొచ్చు. 6 years తర్వాత నుంచి ప్రైమరీ సెట్ కూడా స్టార్ట్ అవుతుంది.
Correct.
26.
So permanent temporary kalpukuni. Permanent 20, that we all know. But the question is, that is the trick of the examiner. कल के अर्थात क्या है, घर जाने के बाद डेंटिशन और एक गर्मा गर्म टीथ टाइट करके पढ़ना है. अयो पीडियाट्रिशियन वाले दूसरे पल है. Whatever, one more student joining online will make it half century. Very good. We don't do any advertisement like many people. It's a word of mouth. Good, doctor. A nerve injured in radical neck dissection leads to loss of sensation on the medial side of the arm. What nerve? चिल्लर की चिल्लर क्वेश्चन. कोई लेटरल बोलता क्या? Suddenly I say question आ गया तो don't say like a handsome hunk came and proposed you. Why me? Because it is not your roommate. So this kind of question, why such a simple question आएगा बोल के tension नहीं लेना. A patient found to have melanoma originating in the skin in left forearm. After removal of the tumor, all axillary lymph nodes lateral to medial edge of the pectoralis are removed. Which axillary node would not be removed? Very good. Excellent. The patient presents with defective adduction of the hip joint and pain in the hip and knee joint. Which is adductor supplied by? Adductor compartment supplied by. Fast. Check. Obturator. Right? Adductor, flexor, extensor compartments. Right? So thigh ka muscles. Nerve supply of leg. Sciatic nerve, it innervates posterior and lateral compartments. Saphenous nerve is a branch of femoral nerve and supplies the sensation of the medial aspect of leg and foot. Femoral nerve is the largest branch of the lumbar plexus and innervates the anterior and medial compartments of the thigh. Agreed? Person had injury to right upper limb. He is not able to extend the fingers but able to extend the wrist and elbow. He is not able to extend the fingers but able to extend the wrist and elbow.
Medial. Fingers की
क्या लॉक किया जाए?
No, it's a high level radial.
Posterior introtius, sir.
Radial branch. Posterior introtius. Oh no. Extension of the fingers and wrist is posterior introtius. Radial nerve innervates the triceps brachiae and anconeus, which are responsible for elbow. అంటే మీరు హై లెవెల్ అన్నారు, రేడియల్ లో లెవెల్ ఆఫ్టర్ posterior introtius comes out. Anterior introtius nerve is a branch of median. మళ్ళీ గుర్తుపెట్టుకోండి, median, ulnar, radial, musculocutaneous, axillary. If there is no question, मेरा नाम मुरली भरद्वाज नहीं, ठीक है? सो इसलिए जरा लिख लो, एक गाइड में लिख लो भाई, हम रेडियल, अल्नार, मीडियन, मस्कुलोक्यूटेनियस एंड एक्सिलरी के बारे में आज रात ही पढ़ेंगे घर जाके, आखिरी चांस है. वेरी गुड. 50 ऑनलाइन. Good, doctor. Thank you all for giving your time and trusting me. A surgeon removes a liver to left of falciparum ligament. So which segment is removed? 2 and 3. The falciparum ligament divides the liver into 2 segments, left and right. The segments removed by the surgeon are 2 and 3, which are located on the left side of the falciparum. 1 and 4 are located on the right side of the falciparum.
1 and 3 on the left side.
Even 3 is also on the. एक बार Covenant's classification of liver segments नीट पीजी एग्जामिनर के क्वेश्चन बैंक में बैठा हुआ है आपके लिए, और एक बार आएगा, जरूर आएगा, ठीक है? Now about Simpson's fascia, what is wrong? Covers apical part of the lung. It is a part of the scalenus anterior. Simpson vessel pass above the fascia. It is attached to the outer border of the second rib and not to the inner border. Edson test is positive for? Come on.
Thoracic outlet syndrome. Superior vena cava syndrome. Vertebral. Superior vena cava syndrome. Cervical.
చెప్పండి.
Thoracic outlet syndrome lo Edson test.
You commit only one thing. Will you marry or not? That's all. ये ट्राई करेंगे, वो ट्राई करेंगे, बोले तो नहीं चलेगा. Come on, what is the answer? Cervical rib కదప్పా. ఎడ్సన్ ఇట్లా చేయి పైకి ఎక్కితే పల్స్ బంద్ అవుతుంది. అయ్యో, कल के नीट पीजी में आएगा आएगा आएगा. Which is rare cause of thoracic outlet syndrome. Edson test is positive in 2 बार पूछा. After death, blood is taken from. After NEET PG. Huh? Jugular is easy to access. No, femoral live में ही पकड़ना femoral मुश्किल है. All are branches of the inferior mesenteric artery except ఇది చెప్పాలి మనం డిస్కస్ చేసినప్పుడు. Come on.
Except superior, middle rectal. Except middle rectal.
Except
Middle rectal.
మిథున గారి పాట మిడిల్ రెక్టల్. చెప్పండి దీక్ష గారు.
Except C.
లెఫ్ట్ కొలిక్ దీక్ష గారి పాట మీరేమంటారు? This belongs to Mithuna. Good. So inferior mesenteric artery is the branch of abdominal aorta that supplies large intestine. Left colic, sigmoid, superior and inferior rectal are branches. Not the middle. The superior rectal artery is the branch of IMA. Sigmoid artery is the branch of IMA. Left colic is the branch of IMA. ఒకసారి మళ్ళీ పోయినాక ఒకసారి మిడిల్ రెక్టల్ ఇస్ ద బ్రాంచ్ ఆఫ్ చూడండి ఏముందో. వాట్ ఈస్ మిడిల్ రెక్టల్ ఇస్ ద బ్రాంచ్ ఆఫ్? కమ్ ఆన్. Shweta's guess is superior rectal.
Internal pudendal artery.
Huh?
Internal pudendal artery.
అట్లా ఎట్లా గెస్ చేసినావు మిథున? పూర్వ జన్మమే. Come on, just I used to read 18 hours a day, sir. Oh, you attended Vinisha's coaching classes?
I read.
Huh? You read? Good, good. All are derived from ectoderm except?
Cortex.
ఏది? ఎడ్రినల్. ఇట్లా ఐ మీన్ కంప్లీట్ ఎల్హెచ్ సర్జ్. ఇట్లా ఆన్సర్లు చెప్తుర్రేవబ్బా. Hypophysis, retina and spinal cord are all ectodermal. Adrenal cortex is derived from mesoderm, not ectoderm. Once more, what is the rule number 1? 1 ectoderm, endoderm, mesoderm, neural crest. Derivative से एक क्वेश्चन pharyngeal arches से जरूर आएगा. आप अपने छोटा डायरी में लिख लो ताकि आप रोज उसको देख लो. वो सब अवेलेबल है स्कोर ऐप में. Please preserve that buzzword, right? A buzzword, if you type in search, you will get all questions notes on that, so that you can keep on repeating before exam. All are features of difficult airway except difficult airway kada TMJ ankylosing ఉంటాయి. ఎయిర్వే పెట్టాలంటే నువ్వు ఓపెన్ చేయాలి కదా. అరే కమ్ ఆన్ మిథున. ఇంక్రీజ్డ్ కాదు కదా, డిక్రీజ్డ్ థైరోమెంటల్. మల్లంపట్టి క్లాసిఫికేషన్ ఆఫ్ అడిక్వసీ ఆఫ్ ఎయిర్వే. You know that?
Yes, sir.
When you lift now, whether you can see both the force.
Yeah, intubations करते sir.
Miller sign is a sign of difficult intubation. Micrognathia, macroglacia also. PowerPoint. Today, evening only I decided, you know. అయ్యో ఓన్లీ 15 క్వశ్చన్లు 2 నిమిషాలు అయిపోతాయి పా. No, I told Suresh that today only evening we decided. चलो भाई 10 दिन में खत्म करेंगे. ఇక లేకుంటే నేను డైరెక్ట్గా వర్డ్ డాక్యుమెంట్ పట్టుకుని చెప్పాల్సి ఉంటుంది. ఎవరికైనా ఇయ్యరని అన్న. So I thought 10,000 questions now. How to create explanatory answers? Chat GPT. So I asked my developer, लगाओ API को. पूरा रात बैठ के Chat GPT gave 10,000 questions के explanations and then made it all ready. So
What is the smallest cranial? Trochlea or factory? No, dorsal.
So now let's continue, doctor. Gantaki, in 1 hour we can finish easily 150 questions if you are in that energy levels, right?
Where there are demonstrations actually I have to stop for one.
हाँ रुक के पढ़ेंगे, कोई बात नहीं, टेंशन नहीं। आप अच्छे मूड में रहना, हंसते रहना, मजे में पढ़ेंगे, मैं तैयार हूं, मगर टेंशन नको बोलना। These are all infraclavicular branches of the brachial plexus except. Huh?
Long thoracic comes from the roots.
Good. Long thoracic comes from, is not an infraclavicular branch, it's a supraclavicular branch, right? And axillary nerve supplies deltoid and teres minor. Thoracodorsal supplies latissimus dorsi. Ulnar nerve supplies all the muscles of the forearm. All are parts of anterior segment of eye except. Chilla rest question. అందరూ ఆన్సర్ చేస్తారు, అది లేనట్టేగా. If questions are too easy, मजा नहीं है. मेहनत का मतलब ही नहीं रहता. अच्छा हम मेहनत कैसे भी नहीं किया ना, आज ही शुरू किया ना प्रिपरेशन. We did. That's what I am trying to tell you. Don't discount yourself. Subacutely.
Kaushik sir, is the writing course. Kaushik sir, from that time it's like I can't do anything. I can't get.
I won't remember anything.
I paid Kaushik to use that. I paid Kaushik. भाई ये लोगों को जरा disappoint, depress करके बिठाओ.
See, so the way he's sitting, the way he's like, no, I don't want anything. Just leave me.
Winning NEET PG. Winning NEET PG इधर है. The war is here, not anywhere else. These are all signs of somatic death except. Come on, फटाफट बोलो. Cessation of respiration, heart, and no response to external stimuli. Non-responding muscle is not a somatic death. It's common. Non-working brain also. All are supplied by anti-intraosseous except. Come on, ये बहुत बार बोला मैंने. Beautiful.
Break radius అంటే మన లిక్స్ రేడియల్.
ఒక నిమిషం ఆగండి.
Oh, that is.
Boxman's issue.
Anti-intraosseous is the branch of median. Oh no. It supplies flexor pollicis longus, prunitor quadratus, and flexor digitorum profundus to the index finger. It does not supply flexor carpi ulnaris. Malla, see, the whole story is like this. Even MS orthopedics may also, people will ask questions on radial nerve, ulnar nerve, median nerve, and fail in the exam hall. Questions are same, answers should be different in postgraduates. So, with regard to first part of duodenum, what is except?
Except develops from focus. Finals working.
అవును ఎక్కడి వరకు అంటారు? ఓ మేడం 4 గట్లనే ఉంటాయి కదా, అప్ టు యాంపిల్ ఆఫ్ అంటారు. యాంపిల్ ఆఫ్ అంటారు సెకండ్ పార్ట్ కదా. Supermesenteric artery, celiac axis supplies foregut, supermesenteric midgut, inferior-mesenteric hindgut. So the first part of duodenum is 5 centimeters. Inferior part develops from the mid. Foregut. All are true about femoral triangle except. Hey, this is what we passed our MBBS exam. No, ये wrong नहीं करना. Wow, 57 ऑनलाइन क्लासमेट्स. अरे 100 टच करो यार, मैं बहुत दिन से वेट कर रहा हूँ. Come on, keep punching your answers, doctor. Radha, Shweta, and many more. Yes, doctor.
So not B, sir. B.
Good.
I said.
Erector longus contain the femoral vessel. Lateral margin is formed by sartorius.
Sir, one second. Sir, 1 second. So it's cross-checking. Please. We cross-checking.
Huh?
Yeah, four is longest only. The medium
What
one
is
is
the longest?
medium one is magnus. Lateral one is not the
Kaushik,
longest one.
you're with me.
Yes, sir.
Good, good.
Sir, previous question. Okay, question 20 is previous question. All are true about equal triangles.
Except, so everything is true.
Everything is true.
Longest boring. Magnus medial.
I don't hate means I love an కదా. Don't hate ante except none ante. I like except none, but you means only you be. These are all true about red muscle fibers except red, white. मतलब रन रखा लुटे आप पहला हमको रेड इनफैक्ट पेल इनफैक्ट पड़ा. फिर भी ट्राई करो. ये तो ऐसी चीजें गेस कर सकते.
Glycolytic metabolism. Glycolytic metabolism.
Beautiful.
Common sense. It's a common sense lesson.
उनको सेंस बोलो.
More mitochondria, glycolytic mechanism, and more.
Aerobic respiration होता है उसमें. इसके हिसाब से सोचो.
हाई मायोग्लोबिन मतलब
Hey. 1 minute.
Glycolytic metabolism that's it.
Red lo high ఉంటుంది కదా మయోగ్లోబిన్.
Glycolytic metabolism that's it. Glycolytic metabolism Glycolytic metabolism
Correct. Answer should be B.
ఫస్ట్ చెప్పిన ఆప్షన్ అక్కడ ఎక్స్ప్లనేషన్ ఆఫ్ గ్లైకోలైటిక్ మెటబాలిజం ఉంది కదా.
Glycolytic metabolism involves the breakdown of glucose to form ATP without the use of oxygen. Already they are rich in mitochondria. Diksha, lottery cancelled. Okay, about short saphenous vein, what is accept?
Medial side.
It runs on the medial, accompanied by sural nerve. Achilles tendon is medial to vein, runs behind the lateral malleolus. You all have done venesection, no? Burns patient me. What is venesection? Venesection అంటే అమ్మా ఒక బ్లేడ్ తీసుకుని ఇట్లా కోస్తారు. కోసి ఆడ వీన్ ఉంటుంది, దాంట్లోకి పెడతారు. With regard to axillary lymph node, what is accept? Come on. What is accept?
These are apical group of terminal lymph. Axillary or axillary. Which is the terminal lymph?
Come on, doctor. Mediastinum is saying that answer is C. Apical group of axillary lymph node lie along the axillary vessels, not at the terminal end. Okay. Then comes skull fracture. What is accept?
Pondus mid-depressed, correct? Pubes rules, sir. Pond, correct?
Mild kadappa.
చాలా పెద్దగా.
Is a mild impact fracture, not a depressed fracture.
What is the depressed fracture, sir?
Depressed fracture is depressed. It is caused by direct blow to the skull. What is Popp's rule? Sequence of the fracture, which is linear, depressed, basilar, diastatic.
Ponds are
Fissured fractures are rotational forces and are commonly seen in infants. These are all true. These are all the following are extrinsic laryngeal membranes except extrinsic laryngeal membranes. Come on, doctor. Come on. Push the answer. Radha, Shweta, Mediastinum, everybody, keep punching. Question number and your answer. Huh? Chepava? Cricotracheal, thyrohyoid, hyoepiglottic, they are all extrinsic laryngeal membrane. Quadrangular is an intrinsic laryngeal membrane, is what we need to remember. About the collagen structure, what is except? Lysyl oxidase. Hydroxylysine undergoes glycosylation. Glycine is the most abundant amino acid. Collagen is secreted by fibroblasts as procollagen. Lysyl oxidase. It is the hydroxyl group adding to collagen require vitamin C, not lysyl oxidase required. మళ్ళీ ఒక్కసారి collagen చదవాలండి. Please remember, types of collagen is in the examiner's question bank. All collagen disorders, Ehlers-Danlos, Weil-Mercansoni, Morphin, you need to be 100% sure. And also biochemistry में collagen. इसलिए आप क्या करो ना, स्कोर ऐप में सर्च में मारो collagen, जो भी आता है क्वेश्चंस और नोट्स पढ़ लो रात को फट फट फट. Now doctor. About the location of otic ganglia, మీరు ఇంటికి పోగానే ఏం చదవాలంటే ఓటిక్ గ్యాంగ్లియా ఒకటి, టెరైగో పాలటైన్ గ్యాంగ్లియాన్, గెసరియన్ గ్యాంగ్లియాన్, सिलियरी गैंग्लियन. ये चार से एक नहीं आए तो मेरा नाम मुरली भरद्वाज नहीं. We discussed this very clearly. और एक बार मैं बोल रहा हूं, मार्च 5 के एग्जाम पेपर, ये 10,000 क्वेश्चंस हमारे डिस्कशन में पार्टिसिपेट करो नेक्स्ट 10 days, right? What I'll do is I'll try my best 60 to 8 hours to discuss at least 1,000 questions every day. Next 10 days में एक मर्तबा खत्म करें, उससे ज्यादा कुछ भी नहीं कर सकते. There is no better plan than this. Do you think there is any better plan? No, no. These are all true about the location of, come on, what is your guess? It is inferior to foramen ovale, lateral to tensor veli palatini, anterior to middle meningeal artery, and it is located anterior to mandibular nerve, inferior to foramen ovale, and lateral to tensor veli palatini. Next. Question అయిపోతుంది.
Do you still think that we are preparing for 2024?
Huh?
Do you still think that we are preparing for 2024?
Preparing for
2024.
who?
Do you still think that we are still in that stage of?
Oh, no. You are all good. You are all really doing it. Please don't take it too seriously. My comments.
No, we need it, so it's the last. We take it very sportive.
हम विनिशा को जरा चिढ़ाते.
विनिशा को बोले तो हम सब हमारा गैंग एक ही है.
एक सारी के चलते बढ़ते हैं.
भरत ने डिस्कवर है तो मतलब यूजर्स को पूछा मतलब मतलब रात में तो पागल हो गए 24/7 में वो कितने प्रोसेस हुआ
रघुवर ग्रीक
में एक सिको चावल बेटा खाना ना तो
जो पढ़ाएंगे तो दिमाग
ये सब तो अगर एक पे से गैस किसी के नाम चलो ओए
See, my niece is one of my niece, very brilliant girl and very competitive girl. मैं उनसे बोला कि do you know the spelling of simultaneous? Simultaneous का spelling मालूम है क्या? बोला उनको just NEOUS बोलने में mistake है. If you do this, she was just in 3rd class. If you do this, you are not worth to be IAS, not even chaprasi of IAS बोल के मैंने बोला. Just funnily. She read all the spellings. Next time, Mama bolo, am I good for... She asked, you asked me some more spellings. I asked another 2, 3. She told correctly. Am I still chaprasi worth or am I collector worth? I thought, what an impact, my sister said. After you stimulated her and gone, whole night she was sitting and finishing. So same way you are asking the question. Are we 2024 worth?
Like already in the insomnia state, and then when you said that word, it just hit on the point.
We didn't want to hear that again.
Yeah. Now, with regard to the liver, what is accept? Come on. Online students keep punching your guesses. That is how sportively we need to finish. Very good. They are hexagonal. Simple question now. Stellate cells are in space of Disc. It is covered by glycan. Kupfer is macrophage, phagocytic. About the thymus, what is accept? Thymus. Very good. The cortical portion में lymphocytes रहता. Medulla contains Hazel, undergoes atrophy, puberty onwards. Thymus is derived from 3rd pharyngeal pouch and undergoes atrophy after puberty. What are Hazel's corpuscles? They are collections of epithelial cells. And is what you need to remember. Once more, मैं और एक बार बोल रहा हूँ. आज time है तो देख लो. Thymus, spleen, lymph node. ఈ మూడు స్ట్రక్చర్ అప్ప ఒక్క క్వశ్చన్ తప్పకుండా వస్తుంది. कल के नीट पीजी में एक क्वेश्चन आएगा. थाइमस, स्प्लीन, लिम्फ नोड के हिस्टोलॉजी स्ट्रक्चर को छोड़ना नहीं है. ओके, नाउ about tibialis anterior, what is accept? Tibialis anterior, fast के पाले, quick to fail.
Inserts into medial cuneiform. Sir, it's like a tibial number.
Edi?
Tibial number. Yes.
So you said A, right?
Yes.
Very good. You can become collector.
No.
It dorsiflexes foot. It is closely related to anteritibial vessels. It inserts into the medial cuneiform and it is supplied by deep peroneal, not the superficial peroneal. What helps in the formation of IVC except embryology? Come on. Guess.
Right petal and vein, sir. Temporal portion of the right petal.
Huh?
D under this, sir. Except under this, sir.
Good. You said D, right?
None of us said D.
Dog or boy?
Sir, none of us said sir.
No, boy cheppeva. Dog. It is the union of right and left cardinal veins, the terminal portion of right vitelline vein, and the posterior intercardinal anastomosis. The subcardinal sinus does not contribute to the formation of IVC, which is included in the chest wall, except. Too much now? And see, if you are a primary health center doctor, you also should qualify, right? Dual nerve supply except. Huh?
Pectoralis major, sir.
Come on. Subscapular is supplied by upper and lower subscapular nerves. Pectoralis major is supplied by medial and lateral pectoral nerves. Pronator is supplied by median nerve only. Pronator, profundus is supplied medial and lateral aspect untadi. Flexor digitorum profundus la medial lateral aspect untadi. Adi kuda rendu nervulu. All these organs directly are touching spleen except. Check. Answer karo. Come on. Stomach, left kidney, colon. इसको क्या बोलते भाई? Stomach bed. It used to be a 5 marks question in anatomy, no? What are the structures in the stomach bed? All righty. All these pass through sinus of Morgagni, except auditory tube, levator valve, palatine, and descending palatine artery, but not stylopharyngeus. What is sinus of Morgagni? It is a depression in the posterior wall of the pharynx between superior and middle constrictor. It is bounded by pharyngobasilar fascia and stylopharyngeus muscle. And it is the site of passage of ascending palatine artery, the pharyngeal branch of facial nerve, and the pharyngeal branch of the glossopharyngeal nerve. This is MSMCH anatomy level question है. मालूम है तो इसलिए first decision, shall I answer or shall I not? No temptation, right? If you kill precisely. चाकू चलाने में precision से करो. इधर उधर नहीं चलाओ चाकू ताकि only few lacerations, abrasions, death is not. Neuromuscular blockade produced by succinylcholine. What is except? I told you, no. NDMR, non-depolarizing muscle relaxants and depolarizing muscle relaxant. एक paragraph में छोड़ दिया ना. अवन्नु नहीं रांगला train of force stimulation. Except fade, because there is no fade. There is no fade of train of force stimulation, no post-tetanic facilitation. Train of force ratio is more than 0.4. ఇవన్నీ ఎక్స్ప్లెయిన్ చేస్తే వచ్చేవి కాదు. అరే ఏముంటుందమ్మా ఇందులో చెప్పడానికి? చదువుడే.
So every stimuli, the muscle action will decrease. So if all the four stimuli decrease at the same time, it is called as no fade. Suppose first stimuli decreases, second stimuli decreases more.
So it is basically, Professor, hello. Depolarizing and non-depolarizing block का concept समझ में आ गया ना आपको? If you understand this, you will understand this. But this is one topic I don't prefer you to logically think. It's a stupid concept. But please, depolarizing, non-depolarizing blockers and differences between them. बोल के एक table है. जरा वो table और एक मत हमारे notes में है. जरा एक बार revision करो. They all pass through jugular foramen except. Mandibular nerve endu pothudappa? Male ovale. Mandibular nerve passes through foramen ovale. One foramina aata hai bhai, likh lo. Foramen spinosum, foramen rotundum, foramen ovale, jugular foramen. One foramen के ऊपर नीट पीजी एग्जामिनर क्वेश्चन नहीं पूछे तो मेरा नाम मुरली नहीं. Jugular foramen. All veins open into sinus venerum. ముందు ఎక్కడ ఉంది? కాల్లో ఉందా, గుండెలో ఉందా, చెవిలో ఉందా? Is it in knee joint or heart? Heart. Small cardiac vein returns blood from the antral wall of the right ventricle to the coronary sinus. It does not open into sinus venerum. Once more, coronary arteries, right, left, coronary arteries, coronary venous circulation. Luckily, there is no coronary nerve supply. Be happy. Coronary artery, coronary veins. కొంచెం మర్చిపోవద్దు. కంపల్సరీ నీట్ పీజీ ఎగ్జామినర్ పట్టుకుంటాడు ఈ పాయింట్. Now, anal wall is found in which part of anal canal? Come on, guess. Lower part of anal canal. Middle part is most sensitive. Upper part is least sensitive. The more you go up, it is not sensitive. No, pectinate is lying. Ankle reflex is at what level? Good, very good. Sahi pakda aapne. L4, L5 is most common level for spondylolisthesis. L3, L4 is most common level for spinal stenosis. Ansa nephrony. Cervicalis मालूम है, नेफ्रोनी नहीं मालूम है क्या? हाँ बोलो. Squamous epithelium. It is the part of the nephron which is lined by single layer of squamous epithelium. Once more, क्या लिखना? मैं क्या बोला मैं आपको? Stratified squamous कहाँ रहता? Transitional epithelium कहाँ रहता? Ciliated कहाँ रहता? Non-ciliated कहाँ रहता? Keratinized कहाँ रहता? Non-keratinized कहाँ रहता? मैंने आपको पढ़ने के लिए बोला. Guess कोटालपा. No, this is a question that you can better guess. Understand? Anisokinia. Fast.
Projection of
different shaped images into visual cortex of two retinae.
Sir, anisocytosis.
Different shaped images into visual cortex of two retinae. Projection of different color images into visual cortex is chromatopsia. Change in velocity of the perceived object strain is known as kinetopsia. Partial intermittent visual loss is scotoma. Anteroaxillary fold is due to which muscle? Check करके बोल दो. All examiners will be, invigilators will be standing. Suddenly you hug them. Let me check here and there. उनको डर लगेगा. 2 मिनट अभी मैं चेक कर दो. If it is axillary fold, it is fine. PR, PV, everything you want to. First time finish clinic like OSCEs. Objective structured clinical examination consoles in PLAB part 2. Right? Pectoralis major. Anterior lymphatic from nose. बोलो. What? I know what Vinisha is going to do. She'll move her nose. So bad. Try करो, ऐसा करो यार. Examiner, beware of meat pigeon. How is anterectal sheath formed? Come on. Yeah. External oblique, internal oblique, and transverse abdominis. Anterior tonsillar pillar. Valleculae. Palatopharyngeal fold is a muscular fold that connects the posterior border of the soft palate to the pharynx. Palatoglossal fold does not form anterior tonsillar filler. Palatoglossal fold connects the anterior border of the tongue to the soft palate. Pterygopalatine arch does not form the anterior because it is the bony arch formed by the maxilla, palatine, and pterygoid process. Valleculae are the small depressions which are located with the tongue and the epiglottis that form the anterior tonsillar pillar. It is not that repeatable question, but still tonsillectomy is a very high yield topic. Na? Everything about tonsils jara pado. Anti-Mullerian hormone. Anti-Mullerian hormone is secreted by? Come on, if you do this wrong, I will be unhappy. Ladyga. Mullerian never learned girls learned. So girls learned boys learned. So boys learned it. Subtly is the structural, no? Lady and the testosterone. Subtly cell, which are found in the seminiferous tubules, they are helpful for development and maintenance of spermatogenesis. Granular cells are in ovary, they produce estrogen, so unlikely to be granulosa. Leydig cells produce testosterone. Subtly are the ones which produce in our life anti-Mullerian hormone, which will prevent the Mullerian growth in the boys. Next one, picture. Good.
Ovarian production.
Come on. Arbor vitae are seen in beautiful folia structure. White matter of the cerebellum, which is made up of myelinated fibers. Arch of aorta begins and ends at Chapandi, Bharat Garu. అంతే కదా ఆర్చ్ ఆఫ్ అయోట ఒకటే చోట స్టార్ట్ అయ్యి ఒకటే చోట ఎండ్ అయ్యి అక్కడి నుంచి డిసెండింగ్ అయోట స్టార్ట్ అవుతుంది. చెప్పండి. T4. Once more. Where does the trachea bifurcate? Esophageal openings anyway, you know, Voice of America. Vena cava is at T8, esophageal is diaphragm में 10, aortic opening is at 12. ये तो याद रहेगा ना. So once more जरा एक बार anatomical levels है ना. That's a favorite question. एक मर्तबा revision करो. Now, doctor, artery piercing the oblique popliteal ligament of the knee is middle genicular artery. Articular cartilage, what is true? It has no nerve supply. Good guess. Good guess. Articular cartilage of the sacrum extends up to how many vertebrae in males? 3 to 3.5. At the level of arch of aorta, what is the relation between vagus and phrenic? Phrenic is anterior, vagus is posterior. Trachea bifurcates at. I told you, no, it's a pattern of examiner. नीट पीजी एग्जामिनर को ये एनाटॉमिकल लेवल्स बहुत मजे में पूछेगा. राइट डाउन दीक्षा एंड शेयर टू. अरे मर्చిపోయినా. Sorry, how can I forget this? 1113 topics we finalized in the descending order that you need to do quick revision. అది ఆల్రెడీ నాన్న సురేష్ అది అయిందా? వర్డ్ డాక్యుమెంట్ కాలే? నేను ఇస్తాను మీకు. డిసెండింగ్ ఆర్డర్ లైక్ మైక్రోబయాలజీ. ఫస్ట్ యూ ఫినిష్ స్ట్రెప్టోకాకై, స్టెఫిలోకాకై, మొత్తం all 19 subjects. It's a very popular list. Once upon a time, the only list that was available of high yield topic based upon the number wise. Every MCQ we did a labeling which topic it belongs and did a descending order before artificial intelligence days. At what level? At least top 15 topics एक मर्तबा revision करके जाओ मस्त every subject में, which I gave you. So at what level does trachea bifurcate? Lower border of T4. Then attachment on the posterior surface of the sacrum is multifidus lumborum. Taylor. So either రెండు క్వశ్చన్లు అడిగాడు నీట్ పీజీ ఎగ్జామినర్. ఏంటి? How much is the articular surface of sacrum? बाद में posterior surface of the sacrum क्या अटैच होगा? जरा देख लो मीडियल में क्या होता है, लेटरल में क्या होता है. सेक्रम का आर्टिकुलर सरफेस भाई एग्जामिनर इज ऑब्सेस्ड, क्योंकि उनके क्वेश्चन बैंक में some prostatomegalic retired professor of anatomy might be little sacro oriented. We don't know, some fantasies of examiners. Orbax is present in all. Axillary artery is divided into 3 parts by pectoralis minor. Axillary nerve is accompanied by posterior circumflex humeral. Once more, what is hit list of examiner? Axillary artery, axillary nerve. What are the branches? What is first part, second part, third part? What are the branches of the first part, second part, third part? And also axillary lymph nodes. What is their structure? How do you remove it? So this is how we need to do reverse engineering of the examiner question bank and get ready. Getting seat don't need lot of reading. It's just smart reading. Then esophagus drains into? Esophagus. Too much कर रहे हैं आप. అయ్యో రామ, నేను మళ్ళా ఇదొక అబద్ధమా? మీరు చెప్పారు సార్, అందుకోసం బాస్, if IVC is thrombosed, the only vessel that carries the blood to the heart is azygos.
Opens into SVC. I've written it down, sir.
Huh? I had a overnight thrombus of my IVC. All the way from subhepatic level up to mid-thigh. I'm just surviving because azygos is taking care. Just because of azygos vein. So azygos vein drains into 10 to 14-year-old contributes how much percentage? Sorry, wrong hai. Okay. No, I think some cushion deformity. Then baroreceptors are located in? Rattinamma, enti? Logic enti?
Logic నేను చెప్తాను సార్, ఎందుకంటే 2 days back మోహన్ చెప్పాడు కానీ 3% నేను చెప్తాను.
The total body surface area in 10 to 14 years is approximately 1.8 meters square, with the back contributing to. Mohan back గురించి చెప్పిండా లేదా? So
పిల్లల్లో 16% ఇది గుర్తు పెట్టుకోదు అని అన్నాడు. అందుకే కదా 16%.
Very good. Baroreceptors are located in?
Intima.
No. Adventitia. It detects the changes in blood pressure. Baroreceptors are related to which vessel? ఏ carotid లో ఉంటాయి? Good. Baroreceptors are? అంటే ఎగ్జామినర్ దగ్గర ఏముంది? బారోరిసెప్టర్ ఉంది. అది అడ్వెంటిషియాలో ఉంటుందా, కెరోటిడ్లో ఉంటుందా, ఉంటే ఇంటర్నల్ కెరోటిడా, एक्सटर्नल కెరోటిడా? एंड हम तो बारोरिसेप्टर कुछ भी मालूम नहीं है, तो एग्जाम में गए तो अच्छा नहीं है. Chemoreceptor, baroreceptor is the hit list of examiner. Base of the heart is formed by? ECG पढ़े हम 4 घंटे पढ़े.
एपेक्स यहाँ पे बेस ऊपर है यार. बेस పైన ఉంటది, ఎపెక్స్ కింద ఉంటది కదా.
బేస్ అంటే బేస్ లోనే ఉంది సార్.
अच्छा मेरे, oh my God, you are thinking base means
బేస్ లోనే ఉంది.
diaphragm सोचो, काई को unnecessarily. So this kind of nursing questions अगर wrong करे तो अच्छा नहीं है. ये तो biology वाला. Which is most anterior chamber? Right ventricle. Most posterior is? Left atrium. Left atrium. That's the reason left atrial enlargement compresses the esophagus, dysphagia, lusoria. Aberrant. Dysphagia, ఏమంటారు అది? Left atrium enlarged అయితే. No, what is that syndrome called? Ortner. Very good. Very good. Bicipital aponeurosis lie over which structure in cubital fossa? Brachial artery. Come on, you all give Bayer block and all that, no? Bicipital lies over the brachial artery. Ulnar nerve passes through the cubital fossa. Radial nerve passes through the cubital fossa lateral to brachial artery. Brachial artery is the main artery, of course. एक काम करो ना, क्यूबिटल फोसा एग्जामिनर के क्वेश्चन बैंक में है, जरा उसका बाउंड्रीज फ्लोर व्हाट इज अबव द बाइसिपिटल एपोन्यूरोसिस, व्हाट इज बिलो दैट, एवरीथिंग जरा एक बार घंटी बजाओ. बायलेटरल रिकरेंट लेरेंजियल नर्व पाल्सी एक्सेप्ट वेरी गुड. थायराइड सर्जरी में दोनों उठा सकते हैं. थायराइड भी हेस्टेट नहीं करेगा, लिम्फेडिनोपैथी भी. Aortic aneurysm at least have some anatomical sense. Only left recurrent laryngeal is in relation with, it will be going underneath the subclavian, no? Bishop's tripod of life includes all except. Huh? బాగానే గెస్ కొడుతున్నారు. అమ్మో, ఇప్పుడు విన్నావా అసలు మొదటిసారా? అచ్చా, యువర్ Bishop's respiration, circulation, brain function, not spinal cord reflexes. Blood supply of the brain कितना है? So many organs are there in the body. Come on. दिमाग को कितना तेजी से मिलेगा? It depends upon whether you are not qualified for PG or qualified. There are फर्क है. इటువంటి guess కొట్టదప్పా. Average blood supply is 500 to 600. 15% of the total cardiac output. Total cardiac output 5000 ml है ना बेटा. उसमें 15% कितना है? 5 liters है ना उसमें से. Blood supply of putamen includes posterior communicating artery ఎక్కడ ఉంటుంది? Putamen too much कर रहे हैं आप. गैंग्लियो कैप्सुलो गैंग्लियोनिक सर्कुलेशन कौन है? MCA ACA लेवल पे होता है. ये तो कहाँ है? posterior communicating artery between two posterior cerebral arteries. No. How can you think it will go and supply putamen which is so anterior? అందుకోసమే. So middle striate, lateral striate, lacunar infarct, choroidal artery.
Sir, నేను తప్పుగా చూసుకున్నాను. All except I missed it. I thought it is supplied by various collectors.
Disagreeable. I missed it except I have put instead of A, B, वो सब नहीं चलेगा. Tell the nanny, not me. Suresh, next dosha ready? అయిందా? పంపించారా? అమ్మా, వేడి వేడి దోశలు వేస్తుండే మా సురేష్. ఇప్పుడిప్పుడే వేడి వేడిగా పవర్ పాయింట్ రెడీ కర్రే.
సార్, ఈ రోజుల్లో మేము ఎప్పుడు ఆన్సర్ చేస్తున్న సురేష్ అన్న ఫేస్ లో స్మైల్ కనిపిస్తుంది సార్. ఇవాళ కనిపించింది. రేపు ముందే రెడీ చేసుకుని కూర్చొని ఉంటాడు అన్న.
Come on, मेरे प्यारे भारतवासियों. ब्लड टेस्ट इज बैरियर. फटाफट बोलो. अम्मा, Leydig cells testosterone subtly or structural. Subtly or structural. Subtly promotes spermatogenesis. Subtly is anti-Mullerian hormone. Subtly is the India-Pakistan border. Blood tissue barrier in testis is formed by తెలుసు. వాటిని ఏమంటారు? ఇంకో పేరు చెప్పండి. అదే అంటారు adjacent Sertoli cells. And remember, 2 बार नीट पीजी में आया है Sertoli. And I corrected one major thing. Tomorrow exam जरूर आएगा एक subtly एक boundaries of quadrilateral space. Once more, quadrilateral space okati, triangular space okati, triangle of lumbar petit triangle is there. No, that also you read. Femoral triangle you read. Wherever triangle is there you read. Falafat bolo except femoral lumbar triangle of petit, quadrangular triangle, triangle of auscultation, triangular, quadrangle triangle नहीं, quadrangular space, triangular space, and triangle of auscultation. एक triangle मारो यार, score app के search में सारे angles आएगा. हाँ, ये क्या है? Boundaries of quadrilateral link except deltoid. Teres major, long head of triceps, neck of humerus, and that is a surgical neck of humerus. Deltoid is not the boundary. Boundary, इनको रास्को, काच triangle कहाँ रहता? दिल में रहता. काच అంటే కక్ష, గుండెలో కక్ష పెట్టుకోవడం అంటే ఏంటి? కచ్చి ట్రయాంగిల్, tendon of Todaro, coronary sinus and tricuspid valve. Boundaries of Koch triangle. Brown color of contusion, hemocytic. Very good. Atla confident undali. Calval view, foot, frontal. Sphenoid is deepest, maxillary is largest, ethmoid is most complex, frontal sinus is between inner and outer tables, and all the other views also jara padlo yaar. Waters view. Malla adigindi examiner odultada. Calval view is used for good. Maxillary sinus is Waters view. Ethmoidal is lateral nasal view. Carina is situated at which level? T4 is the level of sternal angle, T6 is the level of inferior angle of scapula, T9 is the level of the umbilicus. Lower border of? Lower border అని చెప్పానా? ఒకసారి చెక్ చేయండి మళ్ళా. మళ్ళా వచ్చింది కైనాడ్. So इतने बार 6 बोला ना? तलाक तलाक तलाक. 1. Caudate is most superior lobe and labeled as 1. Left lobe of the liver is labeled as 3. Caudate lobe is 4, and the right lobe of the liver is labeled as 6. అందుకోసం ఏం చేద్దాము? కవెనాంట్ చదువుదాం నైట్ కి. COUINAUD स्पेलिंग भी बोल रहा हूं मैं IAS में. COU Kaunad.
It lies slightly to the right of the midline at the level of 4th or 5th thoracic quadrant posterior.
T4 is correct, not T3. Okay, correction. Carina is T4. Carina T4. Carina CARINA kada. Hello. CARINA. अच्छा KARINA. करीना कपूर ले लिया. अच्छा. అయినా కూడా కరీనా అయినా కూడా 5 కదా. Mnemonic cancel. Cauliflower is here is due to थप्पड़ मारने से cauliflower हो जाएगा. Hematoma. Century acinar are present in pancreas. Malla century acinar present in pancreas. Cephalic index is BPD by OFD. రాసుకున్న ఆసిబిడో ఫ్రంటల్ డయామీటర్ అడ్డంగా నిలువుగా ఆసిబిడో ఫ్రంటల్ యాంట్రో పోస్టీరియర్ ట్రాన్స్ఫర్స్. సెర్యూమినస్ ఇన్ ద ఇయర్ ఆర్ modified apocrine glands. Site of development of venous leg ulcer. Goiter area and medial, not lateral. Classical question idi. బొమ్మలు చూపించడము. Suresh, next dosha, next PowerPoint. Kale 50 students online. मैं कल बोल रहा हूं 8 hours. Kaushik, are you ready for 8 hours of game like this? You're not? क्यों? टेंशन आ रहे? अरे इतना सारी चीज है बोल के. See, you said that you are as good as anatomy as engineering student, no? So you should study like engineering student. Only one day. Suresh, next dosha. So देखो यारो. Hey, are you okay with this 8 hours a day? Next 9 days?
8 hours 4 hours చేసుకుందాం.
6 hours.
Hearing is tomorrow. Yeah, tomorrow. Anyways, the market goes on. They did not take money. 8 lakhs are here.
Meet Patel is asking. Hey, Meet Patel is asking. Guy, what is this? Can anyone explain what is going on?
Marathon. Meet guy. He's a bot.
Meet guy. We are crazily panicked about NEET PG.
We are not, sir.
You're not?
No.
That's good. This is called as group therapy. Group therapy for NEET PG. No tension because whole group is 150 touch చేసిపోదమ్మా. ఇంకో 20 కథం చేసిపోదాం. అదే మా వాడు కథం చేయాలి కదా. కల్ తక్ ఐ విల్ కమ్ విత్ 1000 క్వశ్చన్స్. Dog girl is saying 4 to 6 hours is fine. Good.
finished off. You finished daddy tumors and then cute. That's it. And you order about Suresh and I'm telling to you. You are doing it.
So come on, guys. Chemoreceptors are located in which area? मैं और एक बार बोला ना, baroreceptor reflex, chemoreceptor reflex. Tonight only, you're going to kill it. Where are they located? Medulla. Chorda tympani is part of. इतना ENT सुनने के बाद मुरली भरद्वाज के अगर ये क्वेश्चन भी रॉन्ग करे तो
Sir, the vertical part of the seventh row will come.
Sir, middle wall में चोस्टर है.
Anterior wall of the middle ear will come, sir.
Orange bits in middle ear.
Middle ear.
Passes through the middle ear cavity to neck.
Chorda tympani does not carry which fibers? So the answer is middle ear, not actually middle end.
Sir, inner ear both are but originate about middle ear.
Originate.
Why will it go to inner ear, sir? Stapedius muscle bite.
అవునవును బయట ఉంటారు. హే బయట స్టెపిడియస్ కి కాల్ టింపని కి ఏందా సంబంధం? Where are you, man? Chorda tympani carry taste fibers.
Sir, also suppressed stapedius is
Ayyo, Ramachandra. Stapedius is supplied by?
मैं चूस्तना chorda tympani is by lingual nerve to stapedius.
Nerve to stapedius. What are you talking, man? Huh? Chorda tympani is purely sensory. What you are talking? You are talking. Come on, this is not accepted, Bharat.
Okay, sir.
See, remember, facial nerve, trigeminal nerve, oculomotor nerve. ये तीन नर्व के बारे में glossopharyngeal, vagus. One MCQ exam tomorrow. NEET PG is not for 200. It is only for 199. Liklo.
Sir, मैं टेलीफोन वाले को नंदा करना फिर अंदर से.
అన్ని రావాలి అంటే ఆ గ్యాంగ్లియన్ చదవాలి ఇది చదవాలి మంచిగా గర్మగరం చదివి ఇడిచిపెట్టాలి. ఆంధ్ర మెడికల్ కాలేజ్ గుంటూరు मेडिकल कॉलेज में छोड़ेगा नहीं. I will tell anyway. I mean online students are saying क्या स्टूडेंट्स हैं आपके पास chorda tympani जाके स्टेपिडियस को सप्लाई करेगा बोल के बोल रहे. नहीं साहब, हमारे पास 6 महीने से कोचिंग लिया इसलिए इतना ज्ञान भंडार मिल गया कि एक सेंसरी नर्व को मोटार बोल रहे. Hey man, 61 online. Today we will touch 100. చెప్పండి. Preganglionic parasympathetic fibers to parotid gland. Will you promise me facial nerve, trigeminal, glossopharyngeal, vagus, oculomotor, all cranial nerves. Clavipectoral fascia is derived from which ligament? Costocoracoid. Coracoacromial ligament is a triangular ligament that connects coracoid process of the scapula to acromion. Right? Costoclavicular connects first rib to the clavicle. Clavipectoral fascia is pierced by excellent. Lateral pectoral, thoracoacromial and cephalic vein. All of them will pierce. So, 2 बार एग्जामिनर पूछा क्लैविपेक्टरल, अभी भी पूछेगा, जरूर पूछेगा, छोड़ेगा नहीं. अरे और एक बार पूछा, यही पूछा, 2 बार पूछा इसे. Cochleate uterasis. Antiflexion. Fundus is bent forward and the cervix is bent backward. Collagen in hyaline cartilage.
2. Bone is 1.
Bone is bone. Cartilage. 2. Floor. 4. So basement membrane is 4. Right? So मैंने क्या बोला? कोलेजन बायोकेमिस्ट्री में आता है, कोलेजन एनाटॉमी में आता है, कोलेजन जनरल मेडिसिन में आता है. कोलेजन के बिना नीट पीजी नहीं होगा. तो टाइप 5 कोलेजन कहाँ होता है? अगर बाल है तो बाल में, प्लासेंटा है तो प्लासेंटा में, फीटस है तो फीटस में. गारंटी नहीं है कि ये जरूर होगा, बाकी चीजें जरूर होगा. Collagen present in skin. Bone. Type 1 is most abundant collagen, main component skin, ligament, tendon and bones.
All linked to bones, tendons and ligaments.
It is most abundant, yeah. Skin is most abundant. So tomorrow exam hall mein you will आप देखना where is my collagen? Reticular fibers.
And it is most abundant in skin and the hollow organs.
Skin అయితే 1 నెంబర్ చూడండి, ఇంకొకసారి చూడండి మళ్ళా, और एक बार देखो, चेक करो. Nice to see Sariputta Ambade, Meghavi Patel, Meet Patel.
Sir, it is type 1 because it is covering up to 90%. Type 1 understand.
Type 1 kada?
Type 1 is
Type 3 lo kuda untadi, but
most common is type 1.
So we are right now. Commonest ligament injured in ankle.
No,
गिनता स्लो वस्तुदा आंसर. मिसाइल के जैसे निकलना है आंसर लास्ट मोमेंट में. एंटीरियर टेलोफिब्युलर मोस्ट कॉमनली इंजर्ड. स्टेबिलिटी calcaneofibular. All of them are of course. Commonest ligament injured in ankle injury. और एक बार सोच के बोलो, नहीं सोच के बोलो, एंटीरियर टेलोफिब्युलर. खत्म. ओ नेक्स्ट दोषा. So let me, Vinisha, let me once more tell. This kind of session is useful for only 2 people. Either you are completely well prepared or you are completely dumb. अगर आप अमीबा हैं, नहीं तो सुपर होमोसैपियन, ये दोनों को ही ये सेशन यूज होगा. अगर आप मिडिल लेयर में हैं तो त्रिशंकु के साथ टेंशन आके नीचे गिरोगे. कहाँ है बेटा तू? मिडिल में है. But still these things are useful because let me tell you that this is the only fast, smart way to regelate yourself. All right, so let us finish a little more before we go home.
So 143 questions, sir.
Hey, 140 is nothing, रे. कल मैं 1000 per day 1000 खत्म करूंगा मैं. 10,000 10 days. Deal? Come with energy tomorrow. ले మీరు ఇట్లా ఫాస్ట్గా కొడితే కనుక ఏదో ఒకటి రైట్ రాంగ్ ముందు పోతామనే ఉండాలి. like the Jagannath Radha Chakra. Compensatory mechanism in acute hemorrhage? Increased heart rate. अम्मो भाई में तो आके एक थप्पड़ मारे क्या है सर ये ड्रामा कर रहे हैं आप 6 feet 2 inches Kaushik is coming. No, we used to have one professor of cardiology. See, Kaushik, I'll tell you. We used to have one professor of cardiology, tall guy like you. When as a resident, when you present, he used to watch, but suddenly he used to get up, move around, like that. What are you presenting, Mulega Mulke? What is the composition of soda lime? Abba, this is too much guess. Don't guess this kind of things. NaOH 4%, CaOH 90%, KOH 1%, moisture 5%. Wrong. B no. 480, 115. Bahu. बहु बैंगन का बर्तन कैसे बनाओगे 80% बैंगन डालो What is the content of Alcock's canal? कभी सुना क्या Alcock है Al Pacino नहीं Alcock internal pudendal artery अरे very famous మళ్ళీ ఒకసారి రాయండి మీరు రాసుకోండి అచ్చా Alcock is cock is pudendal okay good way to remember Yeah. Last 10 days, anything is okay. See, remember this. Greater sciatic foramen, lesser sciatic foramen. ये दोनों foramen में what contents are there? Similarly, superior orbital fissure, inferior orbital fissure. दोनों fissure में क्या है? जरा गर्मा गर्म पढ़ लो नीट पीजी एग्जामिनर के लिए. Contents of mid-palmar space? Except. Abba, baaje phir idhar gal se? Second lumbrical, FDP, third finger, FDP of fourth finger are all there. Coracoacromial ligament resists which movement? Upward displacement of humeral head. There is an inferior dislocation anterior and posterior. There is no upward. The credit goes to coracoacromial ligament. Corona mortis is kabhi suna nahi. It is a vascular anastomosis between inferior epigastric and deep circumflex iliac. Idana gurtu pettukondi. Deep circumflex. आए तो देख लेंगे. ऐसे देखो 12 साल में 10 साल में खाली एक बार पूछा है कोरोना मोर्टिस तो ऐसे चीजें आते जाते टेंशन नहीं है कॉर्पोरा एरिनेशिया चल ఇది చెప్పకుంటే వేస్ట్ అరే ఫేమస్ ఎమైలేషియా కాదు ఎరినేషియానా మరి మీరేమంటున్నారు ప్రాస్టేట్ అనుకున్నా Prostate అనుకున్నా కార్పొరా ఎమైలేసియా ఏంటంటే देखो बेटा CORPORA MYLACA कार्परा एमाइलेसिया क्या रहता
एमाइलेसिया is in the human brain prostate gland
ఎక్కడ prostate
amyloid bodies in the prostate epithelium
prostate కదా అదే అనుకున్నా నేను మధ్యలో I don't know there is a erinacea also ఉన్నది అసలు నిజంగా ఎరినేషియా అనే స్పెల్లింగ్ మిస్టేక్ చాట్ జీపీటీ నమ్మేటట్లేదు అబ్బా అసలు ఏం కొట్టినావు కార్పస్ లూడియం స్టార్ట్స్ రిగ్రెసింగ్ ఆఫ్టర్ హౌ మెనీ డేస్
10 days 14 fixed కదా సార్
ఓకే
10 days అది ఫిక్స్డ్ కదా సార్ నెక్స్ట్ లాస్ట్ సెకండ్
Huh?
Sir, pineal organ contains several calcified complications called brain sand or corpora herniation.
Very good. Thank you all for attending the session. Come every day. Be part of our WhatsApp chat group. If you want to be joined into the WhatsApp chat group, 9000-868-356. Please ping to this WhatsApp number to join the study group. We have almost all 10,000 students in various WhatsApp groups. And 9000-868-356. So next 9 days, we will have 10,000 MCQs of the NEET PG revised. So please also tell all your friends, inform them. Please download the SCORE NEET PG app, SCORE Learning app. It is available in the Play Store and App Store also.
Suppose first they give the stimulus, you will get 4 responses.
Okay.
Then because of the anesthesia, after the examination will decrease the amount. So depolarizing it, all the 4 stimuli they will decrease at the same level.
Not one after the other.
Yeah.
Suresh.
Indukante whole muscle and whole muscle.
There is no fade.
No fade.
So and non-depolarizing muscle block to etla unnadu. Only second time.
Decreasing order lo vastadi. Fade antaru. ఇది నాన్ ఫేడ్. ఫేడ్ ne kuda.
Fade 4 wave ki na activity ratio ittadu. Ratio ne trade on ratio. Adi less than it is less than 0.4.
దీనికి
Yeah, non-depolarizing.
దీనికి ఫేడ్
Students like
Always only teacher is not good.